Okay, now in our third lecture, I wanted to take you, I don't know, to Africa or to the Netherlands or somewhere. At least I want to talk with you about the title is Principles of Capture-Recapture Analysis. And what I really want to talk about is assessing the sensitivity of surveillance systems and actually addressing one of the major problems which we have with surveillance systems in general. You will see why the elephants in a minute. The content of the presentation is structured into three parts. I want to talk about STI surveillance, sexually transmitted infection disease surveillance in the Netherlands, because this was my first experience with this method, which helps us to try to understand how big is the tip of the iceberg, which proportion of the iceberg does it give us, and how to find out this. I think the capture-recapture method might be useful in estimating the sensitivity, and this is what I want to share with you, so that we understand a bit more what the surveillance data really mean, and as Evelyn said, so that we can get information for action, so that we get a better understanding what is really going on concerning a certain disease in our population. And with this, I want to conclude in about half an hour and give some recommendations. As you probably noticed by now, I really like the wisdom of Albert Einstein, and he, for example, concerning to this topic, he said, information is data touched by the human mind. And actually, this is what we should do. We should use our mind and try to understand better the data, and thus change data into information. Okay, because the general situation is we look at trends over time with our standard surveillance system for a certain disease. While at the same time we assume that no relevant changes took place, that it's usually the same, so that we can compare those trends over time and see, like, if it's going up, oh, it means like the trend is going up, so we have a bigger problem. Or it's going down, oh, we get it under control. Seems to be quite logical. But how good are our instruments? How good is our surveillance system, or are our different surveillance instruments? And what do the trends in reality really mean? I sometimes have my doubts, and you don't only have to look at long periods of time, like 10 years or so, but you can also look at surveillance data of COVID-19, for example, over several months. And I like to remind you that actually often forgotten, but in reality, relevant changes take place. For example, less testing takes place, or whatever other regulations change. So how can we better understand our data? That's my aim. As you heard in the previous lecture, also surveillance, actually, in surveillance, you only see what you look at. And with this pyramid or the iceberg principle, it really depends on what you look at. If you look only at laboratory-based surveillance, an example just brought up before, then we only see the reports. We only have the reports available, positive reports of a certain disease which were tested in laboratories. But not all specimens are positive specimens because of different reasons. Or if you start the other way around, not everybody exposed gets infected. Not everybody infected gets clinical symptoms of a disease. Not everybody with symptoms goes to see a doctor, or can go to see a doctor and be really tested with clinical specimen taken and reported. So we only usually see the top of the iceberg. I don't know how it is in your countries at the moment, but recently with, for example, with Corona, um, I heard in my surrounding lots of interesting stories. For example, this 1.5 million reported cases in Germany, does it mean the total number of cases? The son of a friend of mine just has developed symptoms last Monday. Obvious corona symptoms is fever and cough and so on. And he tested positive in a lateral flow test at home. And so to be reported, to be able to be reported, it needs to be seen by a medical doctor, at least to be a clinical specimen taken for a PCR test to then to be able to be reported. And so the mother immediately contacted the health service to get an appointment for this PCR test, which actually she managed to get an appointment not on Monday, not on Tuesday, but on Friday. By that time, the symptoms were gone. And I don't have clear information if they still went to see her to have a PCR test. So there is a chance that not every case is reported. As just one example, you probably can mention hundreds of other examples how this can be the case, that we only see in the reported numbers only the tip of the iceberg. There might be other factors which influence this, and one of the factors might be might be the health system, and if data are really reported. To be able to measure this, I learned some years ago, and I want to share with you this information, that you can actually get not only guess and feel and follow your tummy feelings, but that you can measure, for example, how strong the underreporting can be. For this, you actually need two parallel surveillance systems. And I was lucky that during my time in the Netherlands, I was asked to do something like this with the STI surveillance systems in the Netherlands, which is on the one hand side, the national notification system, statutory, so mandatory, there's a law which regulates that all gonorrhea, syphilis, and hepatitis B cases are reported from clinicians via a certain route to the Inspectorate of Health. So this is the system which I just mentioned before. This is what you have in all your countries. Normally, by a case definition, these three diseases are reported to the Inspectorate of Health. Luckily, also they have a second route, a second surveillance system, namely mainly run by the municipal health services system, which is voluntary. Nobody has to report, nobody has to be seen there, but as a citizen, you have the right for advice and for maybe a second opinion. So for all potential sexually transmitted infections. So this system collects data on all sexually transmitted diseases, and it's done via public health nurses to the STD Foundation. So two systems which actually do not overlap, but which run parallel. And using this information, I wanted to see like, how big is the tip of the iceberg? How big is underreporting? And what does it tell us about our surveillance system? So the analysis of two relatively independent data sources, focusing on two diseases, syphilis and gonorrhea, which are in both systems, was my aim. And to identify if a person who has been reported in the one system is also reported in the other system, I used some information, namely date of birth, gender, municipal health service, and place of residence, and I matched it, I compared them. the two systems. And on the basis of this, it is possible to estimate the sensitivity of the surveillance system by capture-recapture. So how many of the identified cases are also reported? Okay, so how can this be done? I think the easiest way to explain this is with these fantastic animals. I heard some of you come from countries where elephants are living. Actually, in nature, this was in Asia now. A little baby elephant, which I really liked. Anyway, so is there anybody who lives in a country with a nature park, for example, with elephants in your in our course here? Shirley, what do you think? Do you have elephants in your country?
I think very few. I'm not so sure. I've not seen one myself in Ghana.
Oh, maybe in the, I don't know, in the north it's maybe dry as well. Yeah, somewhere in the middle. Okay, Uzoamaka, you raised your hand.
I mean, yes, we have elephants in Nigeria. I remember as a child, we usually go to the parks to see them, to the zoo, sorry, to see them.
To the zoo, but also in many countries, several countries, you have national parks, for example, where these elephants live. And I'm just talking about this because can you imagine, just let's think about ecology at the moment. If you have a national park with a certain number of elephants in there, is it important to know how many elephants there are? I mean, on the one hand side, if the numbers are shrinking, it's a big problem, but also if the numbers are increasing, if you protect them well and the numbers are increasing, would it be important to know how many elephants there are? Maybe the picture can help you why it would be a good idea.
Yes, I think so.
Yeah, sure, I think so.
Why? Abiel?
Oh, it depends.
Yeah, for our kids, I think we have one big national park of elephants in the eastern part of the country.
Yeah.
And very recently, I have read that there are about 400 elephants.
Yeah.
And they reported as the number of the elephants has been decreasing for the last decade. Actually, it was because of illegal hunting of elephants. So the number is decreasing. So it's good to know, at least to protect them from extinction.
Absolutely, absolutely. It is so. Actually, if you were running, if we would be a team of running a national park and trying to take care of our elephants, we certainly would want to know how many there are. On the one hand side, if the numbers are decreasing, it's really dangerous. Or even if they would be increasing to a certain extent, because as you see on this picture, elephants need to eat a lot. And if you've got too many elephants, it's also not a good idea, because otherwise the nature, the green environment will suffer. So you really need to know. So how can we find out? Does anybody have an idea how we can find out how many elephants there are in our national park, and how we can ensure that that we have a realistic number? I know you might think it's a funny thing. You wanted to hear something about epidemiology, but we're close to it. It helps trying to think about elephants once in a while.
I know from in India that they do like photographic surveys. I'm sorry if there's like some construction noise in the background, but they do photographic surveys in many of the national parks to estimate the population size.
Right, right. And nowadays they do something like this, yeah. Anu?
I don't know about the elephants, but I know that in Finland they are using the drones for estimating how many elks there are in the forests.
They're using what? Sorry?
Drones.
The grows?
Drone, like the little airplane that you remotely can steer.
Yeah,
Get an overview of a certain area.
okay, that's true. Okay, maybe I should also then in the future, when all these technologies increase so much, I should talk about fish in a lake, because if you want to know this, it's difficult with satellite pictures. You're right. One of the ways of doing so, which ecologists have been doing for a long time, is they use something called Capture-Recapture, the title of our lecture. Actually, for example, I think the easiest way to understand this is if you think about elephants. You've got a big park, like, for example, Kruger National Park in South Africa. They have elephants and it's big. You know, Kruger National Park has the size of Belgium, of a country. So a national park where elephants live usually are big. So it's difficult really to see, and the elephants normally don't line up. If you want to count them, they run around in this huge, huge park. So one of the ways ecologists usually deal with problems like this is they would, for example, we are 40 people, we would take maybe 20 cars and drive parallel through this park. And every elephant we see, we would probably maybe not catch because they are hard to hold, but maybe would draw a little cross on their bum so that we would be able to recognize them and count how many elephants we see throughout this day. Once we've passed through the whole park, we would have maybe identified, let's say, we would have probably identified 204 elephants. But this doesn't mean necessarily that we would have found all elephants, because some might have been hiding, some might have been just moving in a wrong direction as we are, so we might have missed some. Can you understand that? It's unlikely that we will see all elephants, even with 20 cars of one driver and one looking all the time for elephants. We probably still miss quite a few, don't you think? I hope you're all nodding now.
Yeah.
Because it's realistic, being realistic. I mean, I really like elephants, and I did a few visits to, I also worked a lot in Africa. And on a weekend, for example, went to see, to the nature. And I think the first five times I was somewhere in nature parks, I never ever saw a lion, for example. And lions are also like elephants. I mean, you should be able to see them, but you can also just miss them. So you can miss quite a few of them. To make sure that you don't miss them, on the next day, you would drive all 20 cars spreading around the park and trying to find elephants again. And if, for example, on day 2, you would have found 100 elephants, like in this example, because, I don't know, the weather was different or whatever, and you didn't find 200, but you found 100. But and now you could also have a look how many of them had this cross on their bum, which were seen the day before. And this were 64 in this case. Based on this data, based on this information, you can calculate how many elephants are in this park. Sounds strange, sounds trivial, but it's true. You can draw a picture like this. You might remember from primary school. We all learned this in primary, at least I learned it in primary school. We talked about this, like if two groups are overlapping at a certain period of time. Does anybody remember this?
Venn diagram.
Yes.
Yes, perfect. So You see, sometimes primary school is really useful. Most times, I need to correct myself. Sorry, but absolutely. And based on this, you can now calculate, does it mean that we have 140 elephants only seen on day 1, 36 only seen on day 2, and 64 seen on both days? Does it mean that, let's sum it up, 240, that there are 240 elephants in this little nature park? If this line around here could be the fence of the nature park.
Unlikely.
Unlike, I agree with you, but why? Why do you think it's unlikely?
Because it's still possible that there are some elephants that we didn't see or we missed.
Absolutely, because still we cannot be 100% sure that they were just walking somewhere else, and because these parks are also big, and even with 20 cars, we probably will have missed some. And these are these question marks here. There might be some more elephants in our nature park. And so it would be really important or useful, as we said before, to know the real number. And this we can calculate on the basis of this. I'll show you in a minute. But before that, I want to take you back to public health or to epidemiology. The picture you are seeing is actually, as the title says, these are the numbers of reported syphilis cases in the Netherlands. Not elephants, but syphilis cases. In the one surveillance system, in the one which we all have in our countries, 204 cases were reported. In the other one, 100 were reported, and 64 of them were reported in both surveillance systems. Interesting. So do you think, well, or extrapolating from the elephants to syphilis, it is also likely that these question marks are somehow other cases which neither were seen in the one nor in the other surveillance system. Right? Can you follow me so far?
Yes, please.
Yes.
Good.
Yes.
Thank you. Thanks. Now I like it. I like how we cooperate together. Brilliant. Okay, so I've got another example, because I told you I looked at 2 diseases in the Netherlands. Gonorrhea seems to be more common than syphilis, and here we did the same. We've got 1,059 in the one system and 753 in the other system. And we see an overlap of 162. I switch around between these 2 slides so that you can see, like, the overlap. The absolute number is bigger for gonorrhea in absolute numbers, but also in overlap. But relatively speaking, there seems to be more overlap for syphilis. Can you see that? This will come into play in a minute as well. Okay. So elephants or syphilis or gonorrhea, doesn't matter. The same principle applies. And we have, what do we have at the moment? We do have information about 2 information sources, or day 1 and day 2 for the elephants, or national surveillance system and public health nurses surveillance system on the other hand. And we know how many, we know the total number of cases in the one source which were found. We know the total number of cases in the other source which were found. Can you see this in this 2x2 table? Like, all of which were found is N1, or all of which were found in the other source is N2, the total number of 2. We know the overlap, so we know how many were seen in the one and the other surveillance system at the same time. If we know this, we also know this, how many were seen in only one of those systems. So the only thing we don't know is the number of cases which were neither seen in the one nor in the other surveillance system, right? And if we would know this, we would know the total number of our elephants or the total number of our syphilis or gonorrhea cases. And okay, let's leave primary school. Now let's go to secondary school. There we learned that if you have an equation with one unknown, you can, which leads to 100% or 1, we can just change the formula and calculate how big this unknown is. We learned this in secondary school, and I'm sure most of you did as well, even though you might not remember, but you did. Sorry for being a bit sarcastic here, no, but that's an easy way of doing so. So on the basis of this, we can calculate the total number, the overall total, the variance, 95 confidence intervals, and we come to these results. These are the conclusion. These are the results, and this is a fantastic, very, very important slide.
Sorry, please.
Yes.
Can we go back to the previous slide?
Yep.
I mean, I'm looking at this, and in my head, it's a little bit mathematically impossible. I mean, mathematically possible, but I think realistically impossible, because our X22, we don't even know them. So how do you even put it in an equation and then you're able to know what you don't know?
So we do know the total number of cases in the one and in the other source. We do know certainly the number of ones which were seen in both sources. We do know those ones because it's this minus this leaves the ones which were only seen in one source. The only thing which we don't know is this one, which would lead us to changing the formula so that we can calculate how big is it likely that how big is the X22. I think that's.
Or is an estimation?
Yeah, absolutely.
Okay.
Based on our observations.
Okay.
All right. It looks more complicated than it is. It's very simple, actually, what I want to say. But your comment is really relevant, because also, of course, when I first heard it, I also needed to think about it. And that's what I want you to do, as I showed you in the first slide by Einstein. I want you to start thinking in a different way. And one of the options is, for example, using this Capture-Recapture method, which then with very simple calculations leads us to these results. And this slide looks very boring, but it's extremely exciting. It tells you here for the two different surveillance systems and for the two different diseases, the sensitivity, the completeness of reporting in the systems for the different diseases. And in brackets, you see the 95% confidence intervals. First of all, it shows you that if we only have a look at syphilis first, you see that the completeness of the national notification system seems to have a completeness of 2/3, 64%. 2/3 of all syphilis cases are reported in the national notification system, and only 1/3 in the municipal health surveillance system. If you now have a look at the confidence intervals, you see that those don't overlap. So it seems like the two national surveillance systems are systematically different, and they are significantly different in their sensitivity. Okay, something you would expect. Probably, yes, they are differently structured and have a different completeness. Right, but you can see the differences here because of the confidence intervals. There's a clear difference. But it gives us already the information like, hey, the national notification system, even for a disease like syphilis, is not 100%, which we would have expected. And we now have an idea, a guess idea, or a calculated idea, but about 2/3 of all cases are reported in this system. Right? So it helps us to understand. But there's one other information in here. If you now look only within the national notification system, the system which you all are familiar because they all exist in all our countries, then you see that the sensitivity for syphilis is, again, still 64%, but for gonorrhea is only 22%. It's much lower. And if you have a look at the confidence intervals, they by far do not overlap again. So it means like this difference is also statistically significant, which means that for certain disease, even within the same national surveillance system, the same numbers, reported numbers, do mean something very different. If 100 cases of syphilis are reported in the Netherlands, it means about 150 cases were taking place. If 100 cases of gonorrhea were reported, it means almost 500 cases were reality. So it tells you something about your surveillance systems and the different diseases, and different influencing factors do play a role. Questions about this, please? Yes, please, Sahid.
Thank you very much. I think this is an interesting concept, but I have two questions. The first is, this is based on the assumption that both surveillance systems are looking for the same thing. They have the same case definition, and both of them, they have the same, perhaps the same reporting in terms of the actual definitions. And of course, all the elements of the other surveillance systems are also there in terms of the people looking for the cases, how they're able to recognize the cases, and so on and so forth. But the question is, I mean, this is something I would love to personally try out. But what if there is no, complementary or alternative surveillance system to provide the other surveillance data that could be used as the recapture element of this concept?
Absolutely right. These are two very good and very important questions. First of all, you're absolutely referring to my next two slides about the conditions that need to be fulfilled that you can do something like this. And I would highly recommend to try it out, definitely. And the second question is about if you don't have the ideal situation of those two systems, then you probably might set up for a short period of time, if this is relevant, another second surveillance system. But let's first talk about the conditions to be fulfilled. You're absolutely right. All cases first of all need to be true cases. So the specificity of a case definition needs to be there, and it needs to be comparable in both surveillance systems. Absolutely right. They need to be comparable in time and space. So you have to have a clearly defined country and the same time period where you look at. All matches need to be correctly identified. So you need to have a good identifiers for person, time, and place. The ones I mentioned before, so that a person who is reported in the one system can also be found in the other system. If this is a bit vague, of course, then the system, this comparison wouldn't work. The same force factor would be same probability of all cases to be identified in every source. So it should be comparable, that they could be identified. So for example, both should have access to, or everybody should have access to both systems. You need to have a stable population. It would be slightly difficult to compare it in Ukraine at the moment, where millions of people are moving out of the country at the moment. There's no stable population, but for most countries you would have that. And the two surveillance systems or sources should be independent. So it should not be that a doctor, a clinician refers a patient with syphilis to the public health nurse for further advice. Then you would have a much stronger overlap. So these two factors should play a role. So these were the answers to where are a few more answers, Sahid, than or conditions than you mentioned, but you're absolutely right, this needs to be fulfilled. And it's not generally applicable everywhere, but it is one way of trying to identify the completeness. And it tells you something that different diseases are, the numbers don't mean the same. We will hear more about this also when we want to compare international data, but even within your country, or even within your system, you need to try to understand what does the surveillance system really do. And therefore, I would come to the conclusion, being almost on time, that the sensitivity of STD surveillance systems varied significantly between different surveillance systems, as I showed you, which is not unexpected, but also for different diseases within the same surveillance system. And one way of looking at this could be this capture-recapture method. And therefore, I think we should discuss it, but I think it could be a good way of trying to understand what the trends over time really mean. And the evaluation of the sensitivity of surveillance data here with one of my co-workers of riding an elephant in Laos gives a better picture of the reality. If not, like nowadays, I mean, if you're only interested in elephants, as also mentioned by one of our colleagues just before, here, picture from BBC, you could also use satellite pictures, maybe. But I think it's nicer to think about capture-recapture when talking about elephants, and it's a good example for public health. That's what I wanted to mention. Now, please, criticism, comments, ideas. What do you think?